Thank you for having me today. And as we've already heard, alcohol is a causal factor in more than 200 different diseases and injuries. Last year alone, 9,641 people lost their lives to alcohol-related deaths. That's the highest in 20 years and something that should shock us all. And as well as the tragic human cost of alcohol harm, as we heard from Dan, there are wider economic and productivity costs which bear repeating, even though these figures are a decade out of date. Back then it was estimated that alcohol costs NHS England around £3.5 billion a year, and the wider economy around £27 billion. Roll that forward with inflation, heaven knows what the true cost to the economy and to human lives are today. But even taking these statistics at face value, they're staggering, and they point to an acute failure to tackle alcohol harm, a failure that has been compounded by stinging cuts to public health and to addiction services, which are leaving too many people in the lurch. Alcohol harm is a key driver, possibly the key driver, of health inequalities, which we know are widening, driving a wedge between the richest and the poorest individuals across the country. Now, I'm not satisfied, given the profound impact of alcohol harm, with some who look at where we are now, shrug their shoulders and blame the individual. Yes, personal choice matters, but so too does the context people find themselves in. The reality is that people in this country are being born with the cards stacked against them. Public health policy should be about mitigating that and making sure that everybody, and I mean genuinely everybody, can lead happy, fulfilling and healthy lives. So what can be done to address alcohol harm? First, we need to fundamentally shift to focus on prevention. As the AHA highlight, in England only 1 in 5 dependent drinkers are predicted to be in treatment. That's just not good enough. Instead, most dependent drinkers are left to struggle outside of the system, battling against dependency without any kind of professional support, only presenting when they have developed very serious acute health problems. It's for that reason that Labour has committed to a radical expansion of the mental health workforce. This would improve early intervention in communities, it would see 8,500 new staff, and it would result in over 1 million more people receiving support each year. The next area of focus needs to be on material circumstances, which are even more pertinent given the ongoing cost of living crisis. We hear a lot about the alcohol harm paradox. Why is it that people on low incomes tend to drink less than people on higher incomes overall, yet the poorest in society are many, many times more likely to die of alcohol abuse or be hospitalised due to heavy drinking? But to me, this isn't a paradox at all. Having little or no money harms your mental health and by extension makes you more susceptible to heavy drinking. This, alongside the wider availability of alcohol in some of the poorest neighbourhoods, and we were talking about this earlier. Think of my own high street in the middle of Denton. Gone are the butchers, the bakers, the candlestick makers. Not that we have many of those. But they've been replaced with bookmakers, chicken shops, takeaways and convenience stores, and the first thing that you see when you go through the convenience store is cheap alcohol and then chocolate and unhealthy food. This is the reason why it's so prevalent in the poorest neighbourhoods. That wider availability of alcohol increases the risk of alcohol harm occurring. To tackle these various contributory factors, we as policymakers need to build a holistic programme to improve public health, one that addresses the environment that people live in, the money in their pockets as well as their access to support services. Now, I want to see this become a reality, which is why I am absolutely delighted with Labour's health mission that was launched a month ago, because it has committed to creating a mission delivery board right at the heart of government, with influence over all the social determinants of health, bringing together all government departments, driving forward health and well-being, so that we can set about, and this is a really ambitious thing to announce, which means a lot to us in this room. It won't mean much to many people outside, but you will know what I'm talking about. We're going to build a marmot nation here in England that proactively reduces health inequalities across England and within the communities that make up England. The third and final part of the equation, and we've heard about it already, is industry. And I've made no secret of the fact that I want the industry to do better. Because if they, as an industry, are advocating self-regulation, but at the same time they are incentivising higher risk drinks through placement and through advertising, do not expect the next Labour government to sit on its hands. And I've issued this warning directly to them already. We are considering a wide range of different interventions, but I would, and have strongly recommended, say that the alcohol industry needs to start getting to work now, ahead of the next Labour government coming in. They don't need to wait for us to do it for them, and they should be working now to tackle the harm caused by alcohol misuse. But if they don't shift, the next Labour government will make them shift. Because if we want a healthier, happier and more productive country, then we need to take alcohol harm seriously. My message today is simple. Thank you for the incredibly hard work you are doing in raising awareness of alcohol harm and holding the feet of policymakers to the fire. I promise you this, the next Labour government will work tirelessly to improve public health, and I look forward to working with you together to make that a reality. Thank you very much.